Hi, I am Christina Wang. I am a rising third-year fellow and chief fellow in the Department of Gastroenterology at Mount Sinai. I'm going to be talking a little bit about my study and to give some background. Prior studies have shown that interdisciplinary IBD centers staffed with a variety of specialists that include, but are not limited to, gastroenterologists, colorectal surgeons, nutritionists, pharmacists, and psychologists are associated with reduced inflammatory bowel disease activity, decreased use of opiates and steroids, and fewer hospitalizations and emergency room visits. IBD patients insured with Medicaid experience higher rates of medication non-adherence, steroid use, and in-hospital mortality compared to IBD patients with private insurance. Our study demonstrates that within 1 year of transition from a general GI clinic to an interdisciplinary IBD clinic, IBD patients with Medicaid experienced less steroid use, an improvement in inflammation, increased access to interdisciplinary services in the form of nutrition, social work, pharmacy, and psychology, and a trend towards fewer hospitalizations, emergency room visits, and surgeries. To our knowledge, this is the first study that evaluates the impact of transition to an interdisciplinary IBD clinic on health-related outcomes in IBD patients insured with Medicaid.
And what are you looking forward to most at DDW this year?
Most looking forward to seeing, as is the case with every year, the new research that has been produced, and especially this year in light of the COVID pandemic, how research has changed and how research has adapted to COVID. So I'm most excited for that.
Is there anything you miss now that the event is virtual?
I would say that I probably miss the most is the sense of networking that you get in person. I think we've done a fantastic job at trying to achieve some sense of normalcy with networking through Zoom and through virtual conferences. Though I think there's a certain element in that kind of relationship and interaction that you miss by not being in person, but hopefully next year that won't be the case.
Okay.